So I guess you can see my screen right away, right? So today's session will be an interactive session. You will provide the answers while I'll guide you. So can someone identify what's in this image? Please, like I said, today's session will be purely interactive. So I need answers.
They are intravenous cannulas.
Okay. Okay, can someone tell us two indications for it, please? Sorry?
Administration of intravenous medication, drugs,
Correct.
and fluid therapy.
Correct.
Administration of fluid therapy.
Okay. Usman Aliyu, could you just mute your mic because we are hearing you and this is being recorded? So, what are the two possible complications that can arise by applying this intravenous cannula? What are two possible? Okay, I'm listening.
Infection could happen, and then maybe air embolism or air thrombosis.
Air embolism is correct. Infection, not really. Infection will be thrombophlebitis, or one can say infection. Yes, correct. Yeah, but infection will be better. You are specific. Yeah. On that question, they may ask about this intravenous cannula. It's what are the sizes and their color codings? They may ask that. So can someone attempt the size based on their color codings? Can someone attempt it? Okay, now I can give you the answer. It starts with white, right? And this, if you can look properly, this is the color. This yellow, blue, pink. These are the color codings, right? Now, for the smallest, commonly is the white, and that's size 14. The next color is gray color, that's size 16. The next color is green color, that's size 18. The next color is pink color, that's size 20, which is this one here. The next color is blue color, which is size 22, and the next color is yellow color, which is size 24. So those are it increases by 2 even numbers, from white to gray to green to pink to blue to yellow. Commonly, the yellow is usually the smallest. What we use for neonates and these children usually less than 1 year old is a common size. So that's. Can you hear me?
Yes.
Okay, so that's okay. Can someone describe how this cannula can be passed? This may not really come out. If it was going to come out, it's going to come out in an oral section in your exam. But yeah, just for the purpose of covering all areas, can someone describe how this is passed? Okay, let me attempt this. First of all, it's you start with this. Most, if you want to attempt describing most surgical procedures or most procedures in either medicine, surgery, procedures always start that most of, not all, though, not all, most of them are usually sterile. So you see that this is a sterile procedure. That's how you start. It's a sterile procedure, and um, proper sterile precautions will be taken vis-a-vis a sterile tray that has the intravenous cannula, a surgical glove, the water for injection, the intravenous cannula, and also a plaster we provided close to the patient. Preferably, okay, the next step will be appropriate counseling will be done and consent taken. Right after you've done the next is identification of the vessel for which the cannula is to be applied. This can be done via direct vision or with a vein finder. Having identified the vessel and the region is cleaned with an antiseptic solution, which is also present in the intravenous tray. And commonly it will be methylated spirit with cotton wool or a swab has methylated spirit in it. A tourniquet is applied initially. Commonly, tourniquet will be applied before, or it's applied before the cleaning. Then the intravenous cannula is removed from its casing and directed along the course of the vein in an oblique direction until it gets into the vein, and then the trocar is removed. Having partially removed the trocar, the intravenous cannula is further advanced into the vein, and then the wing of the intravenous cannula is spread and secured with a plaster. And then the intravenous cannula is covered with the white knob on it. And that's the process of setting intravenous line. Is there any question anybody want to ask before we move further? Is there any question?
Yeah, Chief. The indication will be is it 2 indications?
Yep. One is like I think sorry?
As if for IV fluid.
For intravenous fluid, please, for your exam, do not write things in short, write them in full. Intravenous fluid administration is one. Collection of blood samples is another. Administration of drugs is another indication. So please always write things in full in your exam. Is there any other question anybody want to have before we move from this slide?
Yeah, please, can you go over the sizes again?
Sorry, come again with the question.
Yes, I say, can you go over the sizes again?
The size is okay. Now, the sizes, the largest commonly is white, and that's size 14. You hardly see it in most hospitals. It's not always present. That's size 14. The next size is size 16. That you see it in almost all teaching hospitals, usually in the theater, among the anesthetists. You see there. That's gray cannula. That's size 16. Again, this largest size commonly is size 14. You will hardly see that in most hospitals in Nigeria. The next size is size 16, and that's great cannula. You will see it in most teaching hospitals in Nigeria, commonly in the theater with the anesthetist. The next size is, and sometimes you may see it in the A&E. The next size is the green cannula, and that is size 18. Commonly, you will see that in the A&E, and that's what most surgeons will use, or many surgeons. Many surgeons in Nigeria use green and gray in resuscitation. The next cannula is pink, and that's size 20. You commonly see size 20 cannula among the physicians because most times they really do not do resuscitation that involves hemodynamic, that involves volume loss commonly. So most times, apart from diabetes and some other medical emergencies, they usually will not use green. So you may likely see pink more in the medical session. The next size is blue, and that's size 22. You see this in pediatrics commonly, usually in the older age pediatrics patients. Then the next size is pink, is the yellow, size 24. You're going to see this commonly in the pediatric section, usually in the neonatal people, in the neonatal age range. So is there any question anyone wants to ask before we proceed to the next? There's a question I'm meant to remember. I've forgotten, but when I remember, I will tell you that commonly comes out with this also too. Okay, is any question?
No, doctor.
Okay, so we can progress, have we? There's also a smaller size cannula, size 26. That's purple, but I don't think commonly you see it in your exam because I myself have not seen it either. So. Okay, so let's move to the next.
Is there any cannula that is 21?
No. Cannulas are in even numbers.
Okay. Because it's a question I saw that somewhere.
Okay.
They put cannula 21. I was not wondering whether there's cannula 21. But me too, I know that there's no 21, but that's one past question like that I saw when I was reading.
No, you will need to look at the question again. There's something that comes in odd number.
Okay.
There's one. I think I think it's a catheter or something, or police catheter. One of them comes in odd number. You will need to check that. But intravenous cannula comes in even number. That's a catch because they almost have the same color to coding. But one of them is in odd number. Intravenous cannula is in even number. That which comes with odd number, I've forgotten. If I remember, I'll let you know. And so you must check that question to identify that question is not talking about that. But if it's intravenous cannula, it's an even number. But there's one that comes with odd number, almost with the same color with this, color coding with this.
All right, sir. Thank you.
Okay, so let's move to the next one. Let me just end this recording and start a new recording for the next question.